Talk about some other issues, some things that are happening in the capital, Accra, and the leadership of about 1,000 unemployed nurses in the country are today picketing the Finance Ministry as they demand jobs. The coalition of non-posted nurses say today's action is based on persistent calls to government that have yielded little to no results. Now, in a bit, we'll be speaking to our reporters at the Finance Ministry. We'll be taking you live to the ground as well to give you a feel of what is currently going on there. In fact, I think we can do that now. So let's take you live now to the Finance Ministry and see that action by these unemployed nurses.
Well, some waited over a year, and some very close to 2 years, and it has not been happening that way. But we don't know what transpired before things of like posting has turned to this way. So we just want the government to come out and tell us something.
Thank you very much.
You're welcome.
All right, so we're still here at the Ministry of Health. We're speaking to some of the leaders of the coalition of non-posted nurses. They're presenting their grievances to the Minister of Health or to his PRO, should the Minister of Health not arrive. Their petition this morning includes their complaints as to why they have not been posted, and the kind of response they're receiving from the ministers to their postings, their financial clearance to be posted, and the confusion between the National Midwifery Council and the Ministry of Health regarding the posting of themselves and their seniors from last year. Right now, they're going to present their petition. They want to do that before the numbers get too great. They just want to keep it to the leadership. I'll try and speak to a couple of members of the coalition of non-posted nurses to get their take on what is happening.
Okay, so you just saw the live action at the Ministry of Health. Well, the earlier information they provided for us was that they were picketing at the Ministry of Finance, but apparently they are currently at the Ministry of Health. What they want to do now is to present a petition to the Health Minister or any of his subordinates there. I'm sure they are now looking for the Public Relations Officer of the Ministry of Health. I'm speaking of Mr. Tony Goodman. Well, their concern has to do with the fact that they've not been posted for more than 2 years. Or for some, they say it's been just a year. Others say it's been 2 years. Others speak of time that elapses both timelines. But earlier today on the AM show, one of their representatives was in the studio. It was on the AM show and had an interaction with AM show host Mama Vio Wusu-Abuaji. Well, they've been throwing some more light on reasons why they've had no choice than to picket and present a petition to the Health Minister. Let's take a listen.
It's actually a request to seek for clarification on our posting. Actually, when we get to the ministry, we question them and they are not trying to be open to us. All the time, they give us, let's say, a response, let's say, give us up to maybe next month, come back for your response. And you go there and they tell you, give us more time, give us more time. Yeah.
So tell us about the questions you've been asking. Which of the ministries? Is it Finance or Ministry of Health?
It's Ministry of Health.
Okay. What are some of the questions you've been asking them?
We've been asking them when our posting will be coming and when will we be receiving our financial clearance.
Okay.
But answers are not.
It is only when you're clear that you're paid.
Sure.
But you have not even started the work yet.
We have not even started the work.
Okay. So how many of you are we talking about?
We are actually in 3,000.
Okay. Is it only Greater Accra or this is the entire country?
It's nationwide.
Nationwide. Okay. So all this number close to 3,000, you've been done with school for about 6 months now.
Yeah, actually we completed November 2015. But with completion, you expect them to mark your results, mark your papers and give you the results.
Okay.
So the results were actually released somewhere around February, early February.
This year?
Yeah.
Okay. So normally, I mean, what's been the experience? How soon are the postings done?
It's supposed to be early the following year. Let's say you complete in 2014, you should expect posting early 2015. And we completed in 2015, and we should be posted
like early 2016.
Yeah.
How does it work? You guys don't do national service?
And we have various types of nurses. We have the community health nurses. We have enrolled nurses.
Okay, so that was one of the representatives of the coalition of non-posted nurses who was this morning on the AM show with Mama V Owusu Abuaje. And again, they followed up on that threat this morning. They've been picketing at the Ministry of Health. They say they want to present a petition to the minister or the public relations officer of the Ministry of Health. Gladly, though, we do have Tony Goodman, who happens to be public relations officer of the Ministry of Health, on the line. He's joining us now with some more on what is being done to help these unemployed nurses. Tony, good morning. Many thanks for joining us here on News Day, sir.
Good morning.
Yes. So I don't know whether you've been to the office and whether or not you've seen these nurses who claim that your ministry has failed to post them for more than a year.
I just got back from a meeting and I can see some few nurses in front of the Ministry of Health. I have not also asked what brought them here anyway, but I've heard in the media this morning that some nurses that they are coming to Ministry of Health to demand postings. And as you are aware, currently we have some number of nurses, about 5,000 nurses who have been posted to various hospitals. Some are going through orientation in their facilities. We've requested for additional clearance for those who completed recently. I believe these groups will fall within, or these nurses will fall within these groups. We've requested for a financial clearance to also post. Before we post, we should know that where we posted nurses currently, they may need this category of nurses or that category of nurses before we do further postings. So I will find out which group is it, and then we would.
Okay, so they're saying they're the coalition of non-posted nurses, and for many of them, they've been out of school for the past year. Others, however, say they've been out for about 2 years, and they've still not been posted.
Yeah, so I believe, because, we have a group that were not cleared during the last clearance.
Yes,
I think they should be part of them, because we receive data from National Nursing and Midwifery Council. And according to Nursing and Midwifery Council, they thought they were private nurses because the name was Family Health. So they added them to another list, which went also to Ministry of Finance. But the first group were cleared, leaving this particular one. But all in all, what we're saying is that we are posting. We've started posting since last year. Currently, some are also being posted. We are receiving clearance for further posting, so they will be posted. Yes, that is it. They'll be posted.
Okay, that's some good news. I'm sure that should be a bit of relief for most of them there. But do we know when they'll be posted?
You see, as I said, unless those who have received their postings have accepted it, written back to Ghana Health Service that we've accepted, then they will trigger their payment processes. Then you know that, okay, I've recruited 5,000, and this is how much I'm paying this group. I have to take, because you look at your budget, your sector budget. Okay, I'm taking 5,000 again, and this is how much it's going to cost me to pay them. This is how much will be left for me to also buy drugs and take care of patients. So if you don't do this, they come, you keep posting. At the end of the day, the core mandate, which is taking care of the patient, will not be achieved.
So how long are these processes going to take?
Because it's multi-sectorial, it's not only Ministry of Health. We don't do financial clearance. We do various things. Some agencies will also submit names for us to support Ministry of Finance. So it will be difficult for me to, as just a ministry, say that today or tomorrow, without knowing what is happening in other institutions.
Okay.
So I beg. Yes.
So should it get to your end, how long will it take for them to be posted? Should everything else be sorted?
For us, if we should have the clearance today, we will just distribute or share the names according to the agencies we have, and then they'll start working.
Immediately?
Yes, that is what is happening currently.
Okay.
As you know, if you post people, Ministry of Health, we don't recruit. It's the agencies which need nurses, they will recruit. So we'll just send the persons to them.
Okay.
Then they will go there, and then they will now do their further distribution, maybe to this region or that region, or to this facility or that. So those things happen at the facility level.
Right. Okay. Tony Goodman, many thanks for your time, and I hope you communicate this message to these nurses who seem to have quite a number of issues with the fact that they've not been posted for some time now. But many thanks for your time on News Desk this morning. Tony Goodman is the Public Relations Officer of the Ministry of Health, and he joined us on phone and explained a few things to us as far as reasons why these nurses have not been posted. Now, it has to do with the coalition of non-posted nurses. Well, they say that over the past year to 2 years, most of their members have not been posted. This morning, they visited, in fact, they besieged, let me use the word, they besieged the Ministry of Health to demand jobs. They said they're going to petition the minister to ensure that they get jobs by close of day. The explanation is that there are quite a number of processes that need to go on before they are absorbed into the system. But should all those processes be exhausted, and should the Ministry of Health be given the all clear to go ahead and place them, well, they will be placed immediately, and then they can start work immediately. You're still watching News Desk here on your Join This channel on Multi TV. My name is Kwabna Chen. We're taking a break. When we come back, Emmanuel Abadjiri joins us with business. Stay with us.